All right, everyone, we have a big problem. We have a legitimate mystery diagnosis. And when I say a mystery, I mean a genuine mystery. So for anyone that watched the previous video, just to give a rundown for anyone that doesn't know, Lennox was born at 26 weeks, and he had a grade 3 interventricular hemorrhage, and he needed a VP shunt. Okay. Everything was going well, and around his left eye, we noticed what looked like maybe some ecchymosis, like a bruise, like did he hit his eye? We weren't sure. We took him to a pediatric dermatologist that went down this hemangioma route. So that was peds derm. Well, subsequently, in looking at his eye, it looks like he has venous congestion around his eye. So here's your eye and here's your rectus muscles. And the workup here eventually led us to needing an MRI and MRA of Lennox's brain, face, orbits, neck, and chest. And what became of that is the angular artery around the medial aspect of the eye here is grossly distended in the left eye. The superior ophthalmic artery is grossly dilated asymmetrically. There's mild proptosis or pressure on the eye here, which is a big problem. And then this all drains into what's called the cavernous sinus. And then lower towards the base of the skull here is what we call the petrous sinus. All of these are dilated and distended around Lennox's left eye and orbit. Now, a second pediatric ophthalmologist just dilated him and looked at the veins on the back of his retina here, which all are okay. And his vision is okay. But the proptosis caught my attention, has my concern, has everybody's concern. And so we then had to see what the differential was on this MRI and MRA, which included an AVM, an arterial venous malformation, a dural, so the dura is what surrounds the brain, and remember, he has hydrocephalus and ventriculomegaly. A dural arterial venous fistula was very high on the differential. And then something scarier is a CCF, or a carotid cavernous sinus fistula. And we actually see that in trauma sometimes. So needless to say, he then needed a cerebral angiogram, like a formal cerebral angiogram. So not only did he need 3 hours of general anesthesia for an MRI, MRA, but he also then needed a formal cerebral angiogram. Now, the formal cerebral angiogram was done by at a different hospital system, not the children's hospital that we go to and we love. Different hospital system, different surgeon, different neurosurgeon who is an endovascular neurosurgeon. And they did not see on the study any of these things. It was, the angiogram is clean. So then now, we're literally back to the drawing board. And when I say back to the drawing board, I mean me as a trauma critical care surgeon, every neurosurgeon I talked to, Lennox's pediatric neurosurgeon, we went to the most prominent eye center in the world here and saw an oculoplastic surgeon. So let me write down all the people that are involved right now. His pediatrician, pediatric dermatology, pediatric neurosurgery, endovascular neurosurgery, oculoplastic surgery, regular old peds plastics, who's the dean of the school I work at, is going to see him here shortly. Ophthalmology times 2 all have no idea what's going on. So what I had to do is I had to send the MRI, MRA of his imaging to Boston's Children's Hospital in Harvard. So I sent the MRI, MRA on a disc, had to get that made, shipped, and then I had to get this cerebral angiogram also shipped out. So it's being shipped to Boston Children's to their vascular anomalies clinic. And if anybody has any idea of what's going on, we've worked through all diagnoses. We originally thought this was a hemangioma. Wrong, completely wrong. Then we thought that this was a possible lymphangioma, is what some of the ophtho people think. Then we thought maybe this was a thrombosis of one of these venous sinus tracts, which it's not because the angio rules that out, okay? Then we thought it was most certainly a little fistula, maybe some occult fistula, occult dural arteriovenous fistula, which we have ruled out by the gold standard, which is the cerebral angio. I don't know if you guys can hear the dogs because they're all crazy. Everyone's getting crazy because I'm getting frustrated here. I had a complete meltdown yesterday. And the gold standard study doesn't show what the MRI, MRA is thinking are the most likely sources of this. I've had my chief of radiology look at this. The chief of radiologists at your children's hospital look at this. I've had my neuroradiologists, all the friends I know that are neuroradiologists look at this. Guys, if anyone can solve this, TikTok can. And I am at a complete loss, and I've never been more frustrated. Luckily, the vision is okay in his eye for now. So we're happy that that's going, and luckily he's still being a baby. But somebody please tell me what it is.